is Leticia. She came in because she had issue with fibroids. She came to a clinic and she underwent the Hifu treatment. Today she has come back 2 weeks post Hifu. She has her journey to share with us. Let's listen in. Welcome, Leticia.
Thank you for
Yes.
that. I think just for people who are listening in, it will be wise to begin from how I even ended here
Yeah.
in the first place.
Yes.
So for me, I have had fibroids since 2021. I think that's the first time I realized that I did have fibroids through one of my every year checkup.
Okay.
And I began tracking them because at that point they were very minimal, like 0.01, 0.02. And I remember asking the doctor, and the doctor was like, "These are very minimal. You don't necessarily have to do anything about it." But towards end of last year, I do not know what happened,
Yes.
but one of them really grew to 7 centimeters from nowhere. And because I've been doing those checkups every year just to check if there's any changes of the reports.
Yes.
And towards the 2024, they were very big. And I remember I didn't trust my doctor, so I had to do another second opinion. I was like, let me check this out. Checking it out is even worse because this one was just 2, and then the doctor tells me, "No, you have 3, but one of them is very big." And you immediately, I remember that doctor telling me immediately you have to schedule a surgery. Way before that, even with the imaging, when the ladies saw it, they were like, "This one you cannot pass this year without a surgery because it's quite close to my kidneys." So going back with the reports to the doctor confirmed the same. Did we agree? No, because the moment someone just tells me surgery, I'm like, "No, this is not what I wanted." So what would a normal Kenyan do? Wait it out.
Yes.
Like, let's wait it out. It's not a big issue.
Yes.
Towards October, I think I have, in the history of being a lady, I have never had such pain. Putting in mind I'm a mother, so having gone through labor, that was the worst pain I've ever experienced because of my menstrual cycle.
Maybe to interject.
Yeah.
Previously in 2021, were they symptomatic?
Symptomatic, you mean?
Do they have symptoms like the symptoms that come with fibroids?
Intermittently, yes and no. Sometimes I have always had painful periods way back even before I had my daughter. My daughter is currently 10. So way back even before my period, it's actually going back before my first periods. I actually remember that. I had very bad cramps to the point I would lie flat for 2 days before. I can't move, I can't do anything, I can't eat because it will come out. It was that bad.
Quite severe,
And did it reduce after pregnancy? No. No, Africans are like, when you get a child, these things will
disappear.
No, no, it did not. In fact, I think it got worse because it's the time I experienced the hard pain points I can't remember very well. So 2021, I did get that pain, and that's what made me say, let me check out what's going on. Yeah, because it was very painful. I couldn't even move. I'm shaking. The rest, my pains were always bad. I had to use painkillers, but there were those extreme points that I could not. So again, this year, January to October, same, you use a painkiller, you handle it, 1 day off work because they were that bad. I can't actually go on day 1 to work. But this one was something different, to be honest. This was a pain. In fact, I remember I was in a cab. The lady had to look for cops to bypass the traffic because she felt like someone would die in her own car. Let her get home and take her medicine. It's not my issue. I think that's the time. The first person I called was my auntie, is a nurse. I was like, I think these things I need to consider. The surgery, the open surgery, they're telling me. She was like, if it's closer to your kidney, I think just remove it. People survive. I was like, cool. Again, I am one person, I have to get all my information. So I called my doctor. I'm like, now I'm considering this. The reason I called my doctor is we have that relationship of I knew he's not quick to make some decisions. And if he tells me I need the in fact, if he had told me I needed the open cut, I would have gone for it.
Oh, yes.
Because I know that's one person who really checks out before he actually gives you the verdict of this one. You need to consider.
Yes.
So I talked to him and he's like, yeah, I agree with you, but why don't you consider Hifu? I was like, what's Hifu?
Yeah.
Told me what he knows briefly about it from a
Yes.
doctor's perspective and
Yes.
why he would recommend it for me. Having worked with me for quite some time, he
Yes.
knew I am very keen on my fertility.
Mm-hmm.
I don't like someone making a decision for me when I will get my kids.
Yeah.
Like when I want my kids, I want them now.
Now, yeah.
So don't decide for me, because you have had this cut, take 2 years. I don't know what. No. I just want someone, when I want to get my kids, I want.
You want your kids, yeah.
So he knew that.
Okay.
And having gone through that with him, he was just like, what did you consider Hifu?
Mm-hmm.
And I was like, oh wow, okay, what is it? He
Yes.
told me what he knows.
Yeah.
I got a call from someone called Patrick.
Yeah.
And he gave me the location of where Hifu is, booked my first consultation with the doctor. I really loved the doctor because he understood me. He was very keen to detail because I love details so that I can make my decision on what I want to do.
True.
First things that stood out for me, no cut.
Yes.
We are good to go.
Yes.
First thing. Yeah. Number two, it's a one-day procedure. I don't have to stay in the hospital.
Yeah.
That's another thing I loved.
Yes.
I think the third thing that he had said, the recovery processes, it doesn't affect my fertility.
Yes.
There is no cut part really worked out for me.
Yeah. You didn't want anything to do with surgery at all.
The reason I have stayed 10 years is because I wanted to go the natural way. My child was more of an emergency than the fact that I can't deliver.
Yes.
Normal. I can't deliver normal. It's just the fact that it was an emergency. So I knew that's what I want to do. I have to feel that. So I didn't want anyone to take that opportunity for me because with surgeries again, C-sections, you see, you reduce the number of times. Actually, those are one of the reasons. If I've gone for a C-section, then you do another open cut, then I only have one chance to actually get a child. I would never have gone. Why? Why am I here in the first place? Why did God put me here? Anyway.
So the method would have limited you.
Exactly.
Yes.
Because I've already done a C-section before.
Yes.
You doing the cut again.
Yes.
For growth, not even a child.
Yes.
Because now there were so many, I couldn't just, the one that people, I think there's an option, people carry the pregnancy and then once they remove it, they remove them. I didn't qualify for that. So you mean I'm cutting myself just to remove?
So you weighed your option, like, I've stayed for 10 years after a surgery.
Can you imagine?
Then I have to go another surgery.
For growth.
Not a child. Then I give myself time for recovery.
That's another thing. I mean, the whole biological clock thing is also there, clicking in my
head.
So I think that's why now when I met, my doctor recommended, talked to Patrick, scheduled my first session. The doctor gave me so much details, which I really loved.
Yes.
Immediately after, in fact, I left that conversation, went for my MRI. I was very clear with the doctor. I was like, when we are done, write all the documents you need for me to go for everything.
You were moving with precision.
Yes. And if I remember clearly, I think my session was on a Friday. And the same Friday I had reports. What I loved, the receptionist had told me, your reports compared to the dates you come in should not be 2 weeks apart.
Yes.
So I used that to Friday, next week I will be here. I'll be doing everything. So I went, did my MRI. Surprisingly, I was thinking they are 3, they are 7. And brought them back to the doctor. The doctor scheduled me for simulation. So simulation for just the people on the call is more of them now looking for a clear pathway from what I understood.
Yes.
See, you are very nice doctors. They give me information. I feel like I'm becoming
a doctor.
So they are looking for a clear pathway so that they don't burn any body organs.
Yes.
Because when the kilojoules,
the energy,
the ultrasound energy is passing, shouldn't get any organs around. So that's what they needed to do when before now the procedure putting in mind this is a 1 day thing, so they don't have time to like literally prep. So the prepping was the previous day. That was the next Friday. I was here doing my stimulation. Over the weekend, I was prepping. That was a bit uncomfortable. Prepping for the procedure, moving any food I eat. You know, I'm from the Luya side. And you're telling me I cannot eat for 3 days. Goodness. But anyway, for a good cause.
Only liquids.
Only liquids. So I had to go through that process, and then day 3 flash everything out. One thing I would mention, anyone considering this, please follow those instructions, because now the D-Day, my D-Day was now Tuesday, because Friday I used 3 days. Tuesday I was here now for the process, because Monday was my day 3, so I said Saturday, Sunday, Monday, Tuesday I was here. It's good because I didn't have to go through any processes of flashing out, because I was already ready for the procedure and prepped me. One thing I also say now that I got to figure out on the day I came for the simulation is the fact that my anesthesia was being inserted on my hand, and I will be awake, conscious.
Conscious sedation.
Which I really loved, because another thing I was like, it's a no for the open cut stroke laparoscopy was that injection on my back.
The anesthesia,
because people take quite some time to heal from that thing. I think doctors need to figure out.
Having gone through it during a CS, you have the experience.
I told them I need to sleep. This one I can't do. But for fibroids, I know they can't ask you to sleep. So the other option was that one. So I think
because you had to communicate, during the treatment, you communicate with the doctor.
So I think my options are just going one by one. Laparoscopy,
So Hifu was ticking all your boxes.
I think God just did this one is fully Hifu, because I can't do that. I think, just to digress a bit, I remember I was telling the doctor asked me, why are you so adamant about this thing? One of the days I had taken my daughter for clinic when she was very young, I was waiting for my cab to come because we were already done. And there was a lady on the side. She was in so much pain, older than me, old enough to be close to me. Let me call her an auntie, because if I'm already having kids, that's what my mom. So she was older enough to become my auntie, and she was crying. And I just asked her, what's the problem? And she was like, please never, because I think she thought my daughter was my sister or something. So she's like, never get kids and go for this procedure of the back. She's like, the injection, it takes quite some time, especially if it's not done correctly. The pain on your back
on the spine,
will take a long time to heal from that. You'll have back problems. So when I came here, the doctor was anesthesia. I was like, is it? I was like, no, man. I was like, yes. She's like, why? I was like, I don't like that thing. So having gone through that again, I need to put a very good recommendation for the anesthesia, the aesthetics that I used that day. She was very nice. Walked me through the whole process. Told me what they're going to do, why she's using the from my vein. The fact that I've again never taken alcohol was I learned is quite interesting. Because now she told me she gives people the whole pint. But for me it was just half. I was gone. So it was quite an interesting process. She was like, hey, this one. So by the time we're getting to her, I was like, she's ready. I was on the machine, and I think they began their work. It was interesting because my doctor.
So how was the process as the energy was being released? And considering you were just sedated, conscious sedation, so you'd communicate. How? Maybe a snippet. How was it?
You know what? My doctor was giving me the story because apparently I forgot. And one of my best friends said I should never try alcohol because we already know the kind of a person You're the people who wake up and you're like, what did I do? No, because I'm curious in life. I asked both my brother and my doctor. And my doctor first of all told me my pain levels to the floor. Because they kept on posting, they're like, Daktari, that part's painful. And they would wait. I loved that. And I think doctors see a lot. I think they had to wait for quite some time.
Definitely.
Wait for me to, understand if they need to add the anesthesia. And then they continue the process.
And now that's the advantage of the conscious sedation.
Yeah.
Yeah, because we need that communication for you to tell us, like, okay, there, I think I've really felt that energy.
Yeah. Actually, one thing again, the anesthetics told me why they needed, because again, I asked a lot of questions.
Yeah.
One thing she told me, because it's closer to, the pelvic side, they don't want to hit any nerve that would affect your legs.
Your legs, yes.
So she was telling me if any pain on my legs or anything that I should communicate.
You should communicate immediately.
Yeah, because now it would affect, we might be looking at other organs.
Yes.
But also there's the aspect of nerves also pass through the other parts of your body. So I think also that was quite important. The sedation while you are awake. Yeah. I think the next thing,
I don't know if you remember, maybe at that point when you say, I felt the energy, the doctor was asking, where have you felt it? Did you get that question? Like, where?
I should ask him about my 2 weeks. Because again, no alcohol for me. We've already established that.
Yeah.
But I think, the only things I remember is the fact that I kept on telling them where the pain is.
Yeah.
And the next thing I remember without being told was the fact that we are done.
Yeah, that is.
Wake up, let's go to the recovery room.
Yes.
Yeah. I think I was very excited. I didn't sleep the previous nights. I think I had like 2-3 hours of sleep. Or was it because I had to go to the washroom every single second? But
so what was your reaction when you were told, like, we are done?
I was like, huh?
Like, really? That was all?
I need to recommend your nurse because your nurse told me I should listen to music. I was listening to this and we're putting my music go. We are done.
Yes, we are done.
Did I even do 2-3 music?
Yeah.
But she told me we are done. I was able to walk actually to the bed.
Yes.
I think maybe which is part of the process because the machine requires water. It was very early. My surgery was quite early. I think I was here by 7. I was in the bed. And I think it was a bit cold. I loved the blankets, guys. Customer service is very important. Being in customer service as well, I do understand the small things that also you guys were doing. So kind of like having the blankets for someone. I'm very short, so I couldn't get to the thing that you put for my legs.
Yeah, the leg there. I know.
So I had to improvise in a way. It was very nice. They really walked with me through that process until I was on the bed. The soup thing is interesting. I love that soup. Do you know me? I've never taken soup in my life.
Really?
I hated people add, what is it called? The smell of matumbo.
Yeah.
I don't like it. I think it was my first soup that I was able to take. For the first time, I really liked it. Again, after procedure.
Yes.
Yeah, I think just to let you guys know that now.
That was chicken soup.
You should give me right.
Yeah.
So I need to go with it. But yeah, it was really nice for the chicken soup.
Yeah.
After that, I was going home. Now, this is the interesting part. There is no pain that I actually felt.
Yes.
I remember I actually called my doctor twice. I was calling, are you guys sure? Did you cut any nerve of pain?
Yeah.
Is it normal?
Yeah.
Like, it's very normal. But the good part, they had also told me I would see a bit of blood, just coming out, not heavy, streams of it, to show that actually this happened.
Yes.
So, it actually happened. The very day, not the next day, I was able to see the next day that I had traces of it.
Yeah.
And no pain.
Yes.
Honestly, but there were no pain for the whole first week. I felt my first slight cramping. Again, having described my pain levels and having gone through labor, that is nothing. It's literally like someone scratching you and you're like, oh, I've noticed. Noticing. And it doesn't even require drugs, to be honest, because my doctor discontinued all my pain medications because I was actually good to go.
Because if you don't have pain, there's no
I was good to go.
Yes.
So when the only one that I felt, which was good enough for me to know when I'm putting strain, when I'm sitting, when I'm resting, do I need to lie on the back? In fact, I remember I called the doctor She was like, so if I feel a pain, what do I do?
Yeah.
And she was like, just put ice on that side. I was like, what?
Yeah.
Ice?
Yeah.
Interesting, when you don't have cats.
Yeah.
You know, it's like someone punched you.
Yeah.
Put ice.
Put ice and that's it. Yeah.
Yeah. So that was very interesting
Mhm.
for me. And to be honest, I was already talking to my friends. I'm like, you guys,
Mhm.
can you imagine? There's no pain. Because there's so many people who have surrounded me, and some of them have gone for laparoscopy, some of them have gone for the open cut.
Yes.
I don't think people need to go through that.
Mm.
Based on already 2 weeks,
Mhm.
seeing me seated here,
Yeah.
and I think I was
Yeah.
just telling you the side. I
Yeah.
was joking with some of my friends, and
Yes.
I'm like, how sure you went for
For
surgery?
surgery, yes.
There's no cut.
There's nothing to show.
Have papers.
Yes.
But I've gone through, River Road.
Yeah.
I'm off from work for 3 weeks.
For 3 weeks.
And I have no cuts.
And the following day after procedure, you were back to your normal life.
Yeah. I think my dad was eating solid food.
Uh-huh.
I was really scared of telling some of these guys to visit because they're like, "What?
They may think you're pretending, yeah?
You're already eating. Don't look weak. You have no pain.
And here you have three
Where's
weeks
the cut? 3 weeks.
to recover.
Thank God for my good employer who trusts me, my Christian side.
Yeah.
Yeah, so that was one thing that really stood out for me. For that you have to experience it.
Yeah.
Even if I'm told when I'm being prepped, you cannot, you have to experience it.
Yeah.
And then again, having gone through a C-section before, I know the pain and the hassle that it takes.
Yes.
Yeah. So just comparing the two,
Yes.
before my pre here will
Yes.
be the C-section
Yes.
and this procedure. There was a lot of work I needed to. In fact, I was off for 3 months.
3 months.
It's that serious.
Yes.
Putting in mind is not even the back injection because mine was like the anesthesia that you just sleep. So this was majorly for the wound.
Yes.
And someone taught me the wound is not, the cut would go like 2-3 weeks. Your body has healed the cut,
yes.
but the cut inside,
yes, the internal
is the problem.
Yes.
And having had that experience, and I could even during very extreme cold times, I can still feel it. That thing is something you live by with. Who wants to go through that again?
Yes.
Having another procedure that I don't have to nurse anymore, I don't have anything that I have to take care of, and the fact that they'll just, that's the part I'm waiting for, shrink on their own and disappear. Yes. That's one thing I'm really looking forward to because it's something I would really recommend for anyone. Yeah.
That's nice.
Yeah.
So what message did you have to the women out there who are still having issues with fibroids?
Yeah.
And maybe they don't know what decision
to take.
Because Hifu, it's a new technology.
Yeah.
Some are a bit skeptical.
Yeah.
But you that you have gone through the treatment, at least you can share and let them know something new.
Yeah.
Yes.
I think my first message will be, I know what you're going through. I know the pain of having fibroids and that pain that comes with your periods. I know the issues of fertility. Well, I didn't, that was not part of my symptoms. But that pain, you don't have to go through it. I can imagine if they have really grown, depending on your centimeters, you don't have to strain the other body parts. You will cause so much damage to yourself when you don't remove them, as opposed to why don't you just remove them and then now watch your life on what else could be triggering it. But the bottom line is, why don't you just remove them? And here we have a technology where, again, you do not have any cuts. There are no pain, like they actually shrink on their own, So consider having it. You don't have to stay with that aspect of, I'm not sure. I'm hoping I will do this for the 1 month or the 3 months, the 6 months, to help that person who just feels like this, cannot, maybe you're a bit skeptical. I'm not saying wait for 6 months, but it's already proof enough in my 2 weeks that I already have this testimony to give. And hopefully get my kids Yeah, we should do one. We should.
We're looking forward
do one when
we're looking forward for the Hifu. Hifu baby coming soon. You know?
fully pregnant so that somebody can actually see. Yeah, and I think also we discussed it before. Having had my fibroid at the fundus on the top of where okay, so mine were outside. So it's closer to where implantation will take place inside. That was very risky for any laparoscopy or open cut. Because if they interfere with that uterine, that's it. I'm not able to, no pregnancy will implant.
It's true.
So having had one of the riskiest, fibroids, and I'm still able to be here and I'm recovering well. I have testimony to give. I think anybody should consider going through Hifu. Yeah.
Thank you very much, Leticia.
You're welcome.
So this is Leticia, 2 weeks after Hifu. We're going to have this discussion 1 month after Hifu. And then the best part, 3 months after Hifu, whereby we get to do the repeat MRI. Now we'll get to show you how the fibroids have shrunk and if some have disappeared. Looking forward.
Really looking forward to that one.
True. Yeah. Thank you very much. So we are located at Landmark Plaza, first floor, Nairobi Hifu. You're welcome. If you have fibroid issues, adenomyosis, feel quite free to call us or even visit our clinic for more information. Thank you. Thank you.
Thank you.